Good evening. Thanks very much, Sean, for this introduction. And the last document the Global Commission released was a call for ending prohibition and moving towards legal regulation. So let's hope that this is the next step in South Africa. It may take a little time, but we'll get there. So it's a pleasure for me to be back in South Africa. Thank you for the invitation, and I look forward very much to meeting all of you in the coming days. It's also a pleasure, I must say, to be here in a meeting co-organized by OSF. I'm a member of an advisory board to the OSF Global Drug Policy and Public Health Programs, and to be here as a former executive director of the Global Fund in an event co-sponsored by the Global Fund. But the capacity in which I'll be speaking is being a member of this Global Commission on Drug Policy, which, as you can see on this slide, is a group of 22 people, leaders, formal leaders, that have come together to advocate for evidence-based, human rights and public health-oriented drug policy internationally and across the world. We are 22 members. We lost a few months ago, 2 months ago, a prominent member of the Commission, and that is Kofi Annan. And I would like to dedicate these remarks today to the memory of Kofi Annan. Kofi has been a champion of peace. He has been a champion for drug policy reform, a very active member of our community and of our commission. Of course, Kofi has been the inspiring father of the Global Fund. And to me, he has been an extraordinary friend and mentor throughout the years. So, yeah. So let me start with a quote from Kofi that many of you would have heard, I'm sure, and he has said, "Drugs may have harmed many people, but poor government drug policies have harmed many more." And that's the starting point for the work of the Commission. So let's go back to the preamble of the 1961 Single Convention, and that preamble says that the aim of the convention is the health and welfare of mankind. And as Signe said, this must be our sort of guiding star. But the reality, of course, is that we haven't achieved what was expected in that preamble. Rather, the policies that have been running for 40, 50 years now not only have failed to achieve the goal of providing controlled medicines to people in need for pain management, for palliative care, not only have failed to take care of people who use drugs, their health, their rights, but they've been harmful. And so the first thing the Commission did, and what I'd like to do tonight, is actually take you through a 5-year itinerary. The Commission is 5.5 years old. And take you through an itinerary and show you how our thinking, our collective thinking in that Commission has been evolving from our first report, 2011, that said, break the taboo, let's open the debate, to our report released 2 weeks ago in Mexico City, which is end prohibition and move to legal regulation. Stop prohibition. Move to legal regulation, just as we regulate everything, every substance, every behavior that is of potential risk. We do not prohibit alcohol, tobacco, food preservatives, driving cars, whatever. We regulate what is risky. And this is the government's responsibility. We were not, to be honest, as strong on saying end prohibition 5 years ago. And it's this sort of itinerary that I'd like to depict to you and have you join now. 5 years ago, we started, as I said, with a first call on break the taboo. And that meant open the debate, but an honest debate, not the sort of debate we have in the field of drugs, which is full of a priori, full of ideological, preconceived opinions, an honest debate based on facts and based on evidence. It was also a call for acknowledging the failure of the war on drugs and the failure of policies that for 40 years have been based on prohibition law enforcement. These policies have failed. I think it's worth repeating it, and let me go briefly through those failures. First, they failed by their own measure. They were, if you look at the, not so much the 1961, but the two later conventions, particularly the 1988, which was the most punitive. Or if you look at the ridiculous call for a world without drugs of the 2009 UN High-Level Summit. If you think of these aims, let's eradicate the market, let's have a world without drugs, obviously the world has failed. More drugs are produced, more drugs are available, they are cheaper, of higher purity, more heroin has been produced than ever last year. Cocaine has increased tremendously, and of course, every week, new synthetic drugs are coming on the market. More people are also dependent on drugs across the globe, and this is something that is increasing in Africa. I'll come back to that in a minute. So the punitive approaches have really failed on their goals to extinguish the market. But not only have they failed, but they have generated what UNODC, Signe, sorry for being slightly ironic here, has called unintended consequences. And those unintended consequences have been, firstly, generating a huge criminal black market. And that black market, as you know, fuels violence, crime, corruption, narco-states. That is a market that is currently estimated to be worth $360 billion per year. Big business. It has fueled, these policies have fueled mass over-incarceration across the globe. And I'll come back to that as well. Significant human rights abuses on a daily basis, from death penalty, which is unjustified from a legal perspective, to extrajudicial killings, as what is happening in the Philippines now, to everyday police brutality, or in many countries in Asia, still inhumane compulsory drug treatment. And finally, and because I come from the health and from the AIDS world, it has fueled an AIDS epidemic, a hepatitis epidemic. It puts people at high risk for TB, and in many parts of the world for MDR-TB as a public health threat and as a safety threat. The hepatitis C and the AIDS epidemic, we've seen across the world, but we've also seen how, with harm reduction, the problem can be solved. In my country, France, in Western Europe, there's no more new HIV infection among people who inject drugs. Less than 1% of the new HIV infections are among people who use drugs. The problem is solved, just as vertical transmission is now fully prevented with antiretroviral preventative treatment. However, in Eastern Europe, where Signe and I have met many times, let's say in the Russian Federation, there's 120,000 new cases of HIV infections reported every year, and still 50% of those are among people who use drugs. So, people who inject drugs and harm reduction, no more HIV infections, and probably, if no more, but significantly less hepatitis C infections. There's new data showing that, of course, needle programs, but also OST by itself significantly reduce the risk of contracting HIV for people who, hepatitis C for people who inject drugs. And on the other side, countries that refuse to move to harm reduction and health-oriented policies have huge epidemics ongoing. Now, Kofi Annan said a year and a half ago at a WHO side event that we were organizing, "What worries me now is the African continent. The continent has become a hub for trafficking and the domestic consumption is on the rise. Yet, very few countries have now prevention and treatment services in place and available. Very few countries." So I was really pleased to hear the progress here in South Africa and meet with colleagues from the Tshwane municipality. This is remarkable progress, and I hope that South Africa will become really a leader on the continent. I have no time to go into the detail, but I'll be very much ready and happy to speak with all those interested about the work of a sister or niece of our Global Commission, which is the Commission on Drugs in West Africa that published a report 3 years ago that was led by Kofi Annan and former president of Nigeria, Obasanjo. And that commission now published a new report called a model drug law for Africa, actually for West Africa. I have left a few copies of that document. It's on the web, but I think it's something that South Africa should look at, even if the specificities of the epidemic is slightly different. So AIDS, hepatitis C, and tuberculosis. People do not associate TB with people who inject drugs. But people who inject drugs are 6 to 8 times at higher risk than the general population of contracting TB. And if you are a person living in Eastern Europe who inject drugs and who has been incarcerated, your risk of contracting TB is 28 times that of the general population. Because actually TB among people who use drugs is very closely associated with incarceration. A recent study in Ukraine has shown that 75% of the TB cases among people who use drugs are in fact associated with incarceration. And because people who have been incarcerated at one point end up being released, and because the release from prison is often not well prepared with a good relay in the community, incarceration of people who use drugs, which, by the way, is often incarceration of people just for simple possession, for at least 50% of those incarcerations. That accounts for 10% of the overall TB cases in Ukraine, in the country. So it's a public health issue. Absurd incarceration leads to a public health threat. But AIDS, Hep C, and TB are not the only health unintended consequences or poor policies. Another one, and that is to me a key argument for legalizing and for regulating drugs, is that when you buy on the street, you don't know what you buy. And more often, things you buy are adulterated drugs. Whereas if you were to buy in a shop or wherever, or be delivered on prescription, something that is regulated by the government, you would know what you buy. And we've seen with the opioid overdose deaths in Canada particularly, that are mostly due to heroin that is cut with fentanyl, the tragic consequences of not knowing what you're buying on the street. Another, of course, unintended consequence is that the international drug control regime, in the way it has interpreted the conventions, by being repressive, has really put a set of legal and policy obstacles to the provision of opiates for people who actually need them. And the global picture by WHO is that somewhere around 80% of the people worldwide who need opiates for management of pain or palliative care do not access the medicines. So this is why throughout the years and after our first call on let's open the debate, let's break the taboo, we've published a number of reports on how prohibition fuels the HIV epidemic, how prohibition fuels the hepatitis C epidemic, on how the international drug control regime restricts access to opioid medicines, controlled medicines for people in need, on how, on the opioid crisis in the US, but I won't go into all of this. I will jump to the 2016 UNGAS, which Sean mentioned. We also were sort of waiting for a big moment in drug policy that did not happen, although some progress was made in the language. But as we were preparing for that, we came with a report which advocated for 5 key pathways for drug policy reform, 5 pathways for drug policies that work, as we called it. This is still our Bible somehow and our guiding principles. I'll go into a little more detail on some of these. First, put people's health and safety first. Second, ensure access to essential medicines and pain control. That is, access to opiates for people in need for the management of pain, but also access to methadone, of course, and buprenorphine for harm reduction, because both of these are on the WHO list of essential medicines. 3, end the criminalization and incarceration of people who use drugs. 4, refocus enforcement responses to drug trafficking and organized crime. Stop having the police spend precious human and financial resources in catching every week the same people on the street and arresting people for drug simple possession with no intention to sell or that do no harm to others. In my country, France, 150,000 people are arrested every year for cannabis. 150,000 arrests. France is one of the worst countries. As a mirror image, it's the country in Western Europe that has the highest consumption of cannabis. I think one goes with the other. The more you repress somehow, and out of these 150,000 arrests, whereas it is a criminal offense in the law, in the books, only 100 people end up actually incarcerated. So it means that it's just a ridiculous effort. The policeman arrests people, brings it to court, and then nothing happens. People are released. So can you imagine? And when we are under, terrorist threats, as you've heard, almost every day, and complain about not having enough police. So refocus precious resources, human and financial, towards drug traffickers, towards money laundering. And 5, regulate drug markets to put governments back in control. Take the market from the criminal market to government control over the market. So let me just expand a bit on this. I spoke on health. I'd like to spend a few minutes on decriminalization. Of course, we need to end criminalization and incarceration of people who use drugs, acknowledging that this has led to a huge wave, that I mentioned before, of prison overcrowding and over-incarceration across the globe. In the US, in the Russian Federation, over 50% of the people who are incarcerated because of a drug offense. And in many cases, this is a minor drug offense. This is actually simple possession with no harm to others. And in the US and in a number of other countries. But this has had a devastating impact on communities of color. 43% of the people incarcerated for drug offenses in the US are Afro-Americans, whereas Afro-Americans represent 13% of the American population. It has also had an extraordinarily tragic negative impact on the women. 70% of the women incarcerated in Latin America are incarcerated because of a drug offense. 2 weeks ago in Mexico with colleagues from the Drug Commission, I visited a women's prison in Mexico City, and I met with 2 women, now 30, 35, who were young women left alone with their children, husband left the home, no economic resource, and at one point they agreed to be a mule, a courier. One was sentenced to 17 years, the other one to 25 years. We met them. They've been in prison, incarcerated for already 12 and 15 years. Just unthinkable in human policies. And then just think of what is a criminal record for someone. Having a criminal record is really a huge price to pay when it comes then to employment, education, housing, getting a loan, driving a car, and young people's lives can be just ruined. And here let me quote Kofi Annan again. Quote, "A criminal record for a young person for a minor drug offense can be a far greater threat to their well-being than occasional drug use." Yeah? So let's keep these words with us. And all of what I've been saying provides, I think, a very strong background for us all to advocate for decriminalizing drugs and drug possession for personal use. But it's not only because of these of this that we advocate for decriminalization. We also advocate for decriminalization because we think that criminalizing drug possession for personal use is interfering with a fundamental human right, which is the right to privacy. This is a fundamental right enshrined in the 1948 Declaration of Human Rights. Privacy is the cornerstone of human dignity and the state and of human autonomy. And the state can only interfere with privacy if it is for a legitimate aim, if it is proportionate, and if it is necessary. Now, in our view, penalizing people who possess drugs for personal use and do no harm to others, this is neither proportional nor necessary, nor, of course, legitimate in any way. In addition to that, to us, this in some way criminalizing or continuing criminalizing possession of illicit drugs is somewhere undermines the rule of law, because the law is that this is a criminal offense, and every year 285 million people across the world actually use drugs, and if we keep hypocrite attitudes where we say this is the law and let things and accept that things happen, and we of course have to accept that things happen, and there are many good things also about taking drugs for a number of people, then clearly we're undermining the rule of law, and that leads this misinterpretation. The fact that the French policemen, as I said, have to keep arresting people and then they immediately release them, leads to corruption, leads to misunderstanding by the judges, and we end up again with a law that is not respected. So for all of these reasons, the Commission came with strong recommendations, and there are 3 recommendations. Abolish the death penalty for all drug offenses. Second, end all penalties. And our view is that it's not only decriminalizing, that is not only removing drug possession for personal use from the criminal justice field, it's remove all penalties, both criminal and civil, for drug possession for personal use and the cultivation of drugs for personal consumption. So we just cannot see, on the basis that we believe this is a human right to privacy, we just cannot see why this should be punished at all. And we also advocate for the fact that states should implement alternatives to punishment, such as diversion away from the criminal justice for all low-level, non-violent actors of the drug trade, such as those engaging in social supply, drug couriers, user-dealer, and cultivators of illicit drugs. Those that are driven often by poverty and marginalization in society have no other opportunity than go into the drug business. And if there is something that we could hope, Sean, would be, would happen not too long from now in South Africa, I think it's ending penalties more than beyond decriminalizing all drugs, and looking at alternatives to criminal punishment for low-level actors. Let's hope that by next Drug Policy Week 2019, this is what happens. And the last recommendation was on regulation and ending prohibition. we're saying legal regulation, move to legal regulation. We're not saying move to legalization, because legalization is often misunderstood as, let's say, uncontrolled liberalization somehow. That's not what regulation is. Regulation we understand as responsible risk management by governments. Just as I said earlier, as you manage everything that is risky. And that is tobacco, that is alcohol. And if you look at some of the global burden of disease studies that were published in the Lancet in September, despite the fact that the burden of tobacco and alcohol-related harm remain huge, the world is making progress. But the world is not making progress by prohibiting alcohol or tobacco. Although alcohol kills 3 million people every year, and tobacco will kill 50% of smokers. We are regulating tobacco, alcohol, and that's how we're making progress. And I'm sure many of you will have witnessed in South Africa progress over the years with tobacco. We're regulating pesticides, we're regulating food preservatives, we're regulating radioisotopes, we're regulating potentially dangerous medicines that, by the way, overlap, of course, with the now illicit drugs. So that is the reasonable way to handle, not prohibiting. And of course, the US have done the experiment with alcohol prohibition. That has led to a huge criminal market, just as we have witnessed with illicit drugs. So why is this exception remaining? And this is why I think what all of us, have now to try and change in this country and everywhere across the world. Because too many people have died, too many people have suffered, too many people are suffering today of the harms of prohibition. So it's time to rethink, fundamentally rethink the way we look at drugs and move out of prohibition. I won't go into details here. Steve Rawls will give a plenary on regulation tomorrow, I understand. But regulating drugs, as I'm sure he will discuss, is about every step. Regulating production, so you know what you're actually producing and you know what's the content of the drug that will come on the market. It's about regulating price, potency, packaging, availability on the market, be it in an unlicensed shop, let's say for cannabis, as it probably will be across the world soon, or in licensed premises, or in specialized pharmacies, or for the most dangerous drugs, let's say on medical prescription. And because, let's be clear, when we say currently prohibited drugs should be regulated, it's about all drugs, and heroin-assisted substitution therapy programs in Switzerland, for example, or in the UK, are to me a model of what could be a medical prescription of heroin for some people. So, but anyway, the precise delineation of how countries will move to regulation will, of course, depend on the drugs, but also on the social, political environment in countries and cultural environment on countries. I believe this will be an incremental process, but steps are being taken. Of course, legal regulation of marijuana for recreational use. In Uruguay, then in a number of US states by referendum. Very interestingly, states have gone against the international conventions. And the federal government, the Obama administration, and now even the Trump administration, do not say anything. Some of you have heard Ambassador Brownfield from the US a few years ago when Uruguay announced that it will legalize cannabis, saying this is against the convention, we will fight it. Now that referenda have brought cannabis regulation to many US states, Ambassador Brownfield has been saying, well, there are flexibilities within the conventions that we should consider. I was very interested in the experiments that have started in New Zealand with NPS, with synthetic drugs, where New Zealand said, okay, if you wish to produce and sell a synthetic drug, bring us a dossier, just as you would submit a new medicine to a national agency with the content, the way it's produced, the dosage, what you know about the effects, and we then may allow that product to be sold in adult shops. And as this started being put in place, the number of circulating synthetic drugs in New Zealand decreased drastically because people went for buying drugs that they would know what they are, instead of buying on the streets potentially adulterated drugs. So steps are being taken in that direction. So that's where we have come to in these 5 years of our itinerary at the Global Commission. And now we are very clear, and I would like to be very clear tonight. The ultimate goal of all our efforts in drug policy and drug policy reform should be ending prohibition. If we continue with prohibition, we will continue with law enforcement repressive approaches, and that will mean continuous failure and continuous harm. Ending prohibition is, to me, an unambiguous endpoint of where we should go. And so we need, my call tonight, I'm realistic. That will not happen from one day to next. But my call is, again, open the debate. Open the debate and look for allies in that debate. And we will have in the drug policy movement allies, of course, in the health sector, because of the health harms, and in the human rights sector. And I'd like to close with a few words on human rights, because Sean, you rightly said that this is at the very center of everything we need to do. And we will never achieve anything if we do not put human rights at the forefront of everything we do in drug policy reform. And these human rights have been enshrined in the 1948 Declaration on Human Rights and in a number of other conventions and treaties in the United Nations. Let me remind you, the right to health and to decent care, the right to freedom from discrimination, the right to equality before the law, the right to privacy, the right to benefit from the advances of science. These are all human rights. So let's remember there are also the rights of people who use drugs. And we will not win the fight against HIV/AIDS, hepatitis, TB, stigma, discrimination, marginalization, incarceration, if we do not win this fight for those rights at the very beginning. Thank you.